Hey everyone, Dr. Mike here. Today we're going to talk about something that affects millions of people, rheumatoid arthritis or RA. Let's break it down in a really simple way. Imagine your body has a security team called the immune system. Its job is to protect you from invaders like germs and viruses. But with rheumatoid arthritis, this security team gets a little confused. It starts to mistake your own healthy cells, specifically the lining of your joints, as the enemy. This is what we call an autoimmune condition. It's not your fault. It's just how your body is wired right now. And we have ways to help manage it. This mistaken attack causes something called inflammation. Think about what happens when you get a splinter. The area gets red, swollen, warm, and it hurts. That's inflammation at work. Now imagine that happening inside your joints, like in your hands, wrists, and knees. This constant inflammation is what causes the main symptoms of RA. You might feel pain, stiffness, especially in the morning, and swelling in your joints. Over a long period, this can cause real damage to the joint itself, which is why getting it under control is so important for your long-term health and mobility. It's crucial to understand that RA is more than just joint pain. Because the inflammation is body-wide, it can make you feel tired all the time, almost like you have the flu. Some people might run a low-grade fever or lose their appetite. This systemic or whole-body nature of the disease is what makes it so challenging to live with day in and day out. It's not just about achy joints, it's about how you feel overall. We're not just treating the pain, we're trying to calm down that overactive immune response throughout your entire system to help you feel like yourself again. So, the goal of treatment isn't just to mask the pain with painkillers. The real mission is to talk to your immune system. We want to tell it to calm down and stop attacking your joints. By reducing that underlying inflammation, we can do more than just ease your symptoms. We can actually slow down the disease and help prevent long-term damage to your body. This is where some of the most exciting medical advancements come into play, giving us smarter and more targeted ways to help you manage your RA and live a full, active life. So, how do we calm down that confused immune system? For years, we used broad medications that suppressed the entire immune system. Think of it like using a giant fire hose to put out a small kitchen fire. It works, but it also makes a huge mess and soaks everything else in the house. These older drugs could leave you more open to all kinds of infections. But now, we have a much smarter approach. We have biologic treatments. These aren't your typical pills made from chemicals. Biologics are complex proteins made from living cells like yeast or bacteria. They are designed to be much more precise. Think of your immune system's attack as being coordinated by specific messengers, like little text messages telling the immune cells where to go and what to do. Biologic drugs are designed to be like signal jammers. They don't shut down your whole immune system. Instead, they find and block one specific type of messenger, or one specific type of cell that is causing all the trouble in your joints. This targeted approach is a game changer. It's like sending in a special agent to stop just the one bad guy instead of sending in a whole army that causes a lot of collateral damage. This precision is what makes biologics so powerful, and often so effective for people with RA. Because they target a very specific part of the inflammation process, they can be incredibly good at stopping the disease in its tracks. For many patients, this means less pain, less swelling, and a real chance to slow or even halt the damage to their joints. It's a way of working with your body's complex systems in a more intelligent way. We are moving from a sledgehammer approach to a scalpel, and that makes a world of difference in how you might feel. It's also important to know that biologics are usually given as an injection you can do at home or as an infusion at a clinic. This is because they are large protein molecules. If you were to take them as a pill, your stomach acid would just break them down and digest them like it does with a piece of steak. They wouldn't even make it into your bloodstream to do their job. The shot or IV drip allows the medicine to get directly into your system, where it can find its target and get to work calming down that inflammation. Now, for the exciting part. As of 2025, medical science has given us even more advanced biologic options. We're getting better and better at pinpointing the exact troublemakers in the immune system. One of the newest classes of drugs getting a lot of attention targets something called Janus kinases, or JAKs. While not technically biologics, they are often grouped with them because they are also targeted therapies. These are pills, which is a big plus for many people. They work from inside the cell, disrupting the inflammation signal from within, offering another powerful way to stop the immune attack on your joints. Another exciting area is the development of biologics that target new pathways. For example, we now have treatments that block proteins called granulocyte macrophage colony stimulating factor, or GM-CSF. That's a mouthful, I know. But all you need to know is that it's another one of those messenger proteins that stirs up inflammation. By blocking it, we can sometimes help patients who didn't get enough relief from older biologics that targeted other messengers, like TNF-alpha or interleukins. It gives us another angle of attack when the first or second plan doesn't work as well as we'd hoped. We are also seeing the rise of biosimilars. Think of these like the high-quality generic versions of biologic drugs. The original brand-name biologic is very expensive to develop. Once its patent expires, other companies can create their own version. A biosimilar is proven to be just as safe and effective as the original biologic, but it can be much more affordable. This is huge news for patients and the healthcare system. It means more people can get access to these life-changing medications without the massive price tag, making top-tier RA treatment more accessible for everyone. Finally, research is pushing toward even more personalized medicine. In 2025, we're getting closer to being able to run tests that might predict which biologic will work best for you, based on your unique genetic makeup and disease markers. Imagine not having to go through trial and error trying one drug for a few months only to find it doesn't work. The goal is to one day be able to choose the right drug for the right patient from the very beginning. We're not completely there yet, but the progress in this area is incredibly promising, and a major focus of current research. Let's be real about these treatments. The benefits can be incredible. For many people, these new biologics can lead to remission. That means having few or no signs of active disease. It can mean waking up without stiffness, being able to open a jar without pain, or getting back to hobbies you thought you had to give up. The main goal is to prevent further damage to your joints, preserving your mobility and function for years to come. These drugs can truly give you your life back, and that is an amazing thing to see as a doctor. It's the reason we get so excited about these advancements. However, we have to talk about the risks. Because these drugs work by tuning down parts of your immune system, your body's ability to fight off infections can be reduced. This means you could be more likely to get sick with things like a cold, the flu, or more serious infections. Before you start any biologic, your doctor will test you for hidden infections like tuberculosis. It's also why it's so important to be up to date on your vaccines and to call your doctor if you develop a fever or feel unwell. We are trading a bit of immune strength for a lot of relief from RA. Another challenge can be the cost and the method of administration. While biosimilars are helping, these are still very expensive medications. Getting insurance approval can sometimes be a frustrating process, but your doctor's office has people who are experts at helping with this. And as we discussed, most biologics require injections or IV infusions. This can be intimidating at first, but I promise, most patients get used to it very quickly, and find it's a small price to pay for the relief they feel. It's a routine you get into, just like any other part of managing a chronic condition. So, what's the takeaway? The world of RA treatment in 2025 is more hopeful than ever before. We have smarter, more targeted, and more effective tools to fight this disease. These new biologics offer a real chance at remission and a high quality of life. But it's a partnership. You and your doctor need to work together to choose the right treatment, monitor for side effects, and make adjustments as needed. There will be checkups and blood tests. But there is so much reason for optimism. Stay informed, ask questions, and be an active participant in your care. You've got this.